everybody. Coming to the second part of the topic endodontic mishap. Here we'll be dealing with mainly the instrument separation and the obturation and post-phase related endodontic mishaps. So the instrument separation is a frequent accidents both with hand or with the rotary instruments. So it is more frequently occurring during with rotary instruments rather than a manual hand instrument. And the retrieval of an separated instrument mainly depends again on like the management for root perforations. It mainly depends on the level of separation and also the location of the root canal curvature. Like if the level, we have to assess whether if it is in the coronal, middle or apical, and if it is in the coronal it should be retrieved to negotiate the rest of the canal. And if it is a long instrument, there is much more prognosis for the retrieval. So it is basically certain things. So we have to see the type of the instrument that is separated, the length of the instrument. So the type is rotary and stainless steel. So certain authors recommend stainless steel for easy retrieval, and certain others they have rotary for easy retrieval. And so that is, there are two contradictory statements, so depending on the type of the separated instrument. And we have the length of the instrument. If it is a very long instrument, it is easy to retrieve rather than for a short instrument, and that too if it is located in the apical third, it is very difficult to retrieve. So in such cases, negotiating or bypassing the instrument is the treatment option. Then degree of the canal curvature. If it has if it is separated in a curved location, it is difficult for retrieval. And also the tooth type. If it is a anterior, it is much more visible and accessible. But if it is a lower molar or an upper molar, it is difficult to retrieve. And especially this retrieval is possible only with the help of certain specialized aids like the microscopes or the surgical loops, etc., which can enhance the quality of the instrument retrieval. So there are various techniques for instrument retrieval. There are for this, and we have to know the names mainly. Okay, hypodermic surgical needles, chemical solvents, mini forceps. This mini forceps and all is, as the name suggests, it is a forceps. So it is not that we can engage it in up to the canal apical canal, one third of the canal. So we can only retrieve the instrument using a mini forceps if it is loosely bound, and also if it is in the coronal third, we can retrieve with this mini forceps. This chemical solvents means it actually dissolves the metal, but that and all is not very commonly available. Mini forceps can be used only if the instrument is separated in the coronal third and also it is very loose. That means in a already wide distal canal, if a 10 size instrument has separated, and that too if it is in the coronal aspect, this can be retrieved. It is such a scenario where we use a mini forceps for instrument retrieval. Then we have brooch and cotton. We have wire loop. That means the wire is bent into a loop. It is inserted and pulled. But again, we need to create a platform for all this. We'll tell about that. Then braiding of endodontic files. K files or two K files are together braided. It is inserted, pulled, similar to wire loops. Then we have specialized instrument retrieval kits like Mazarin kit, post removal system, and canal finder system, endo extractors, etc. Then we have ultrasonics, file removal system, and softened GP technique. So all the above mentioned like mini forceps or whatever, like we have the braided files, or we have the kits that is available, Mazarin kit, post removal system, canal finders, then we have the endo extractors. So all this system, we have to first use an ultrasonics. That means ultrasonics to we have to make a platform for all these instruments to engage on, because if it is in this is the location of the instrument, suppose we cannot this if this is the canal. Okay, if it is a narrow canal, we don't have an access to this part of the instrument. So with ultrasonic, we have to create a platform for the engagement of these instruments. So before going into any instrument retrieval system, we have to first see that there is a platform that is created with ultrasonic. Once the platform is created, any of these measures can be used. Like we can use braided files, or we can use wire loops. We can use several other extractors, or the Mazarin kit, the canal finder systems, post removal systems. All the systems can be used unless only a ultrasonic platform is created. We can do all this. Then various other techniques like laser irradiation and dissolution using electrochemical process. So at this level, we have to know that instrument retrieval is only possible with certain types of specialized instruments. So there are various other methods like laser irradiation or dissolution or electrochemical processes. So before into going into the details, so basically we need to know that everything we need to create an ultrasonic platform before insertion of any of the above mentioned instruments. So that is the thing we have to know about instrument retrieval and the factors affecting the instrument retrieval, like basically the level of the separation, the location of the separation, the type of the instrument that has been separated, and the length of the instrument that has separated. So this is the basics about instrument separation. So instrument separation can be asked as a short note. So mentioning about each of the instrument retrieval systems, that means explaining about each and everything is not necessary, but you have to know the types of instrument retrieval measures that we commonly use. Now, this is a table which is showing a favorable prognosis of the tooth with instrument retrieval and something that is having a difficult prognosis. So, if it is in the coronal or in the middle part of the root canal, it is a favorable thing to retrieve the instrument. But if it is in the apical part, it is difficult. If it is a long fragment, it is good. If it is in the straight part of the root canal, it is good. Top of the fragment coronal to the curvature. That means if a curvature is there, if this is the curvature, if the instrument has separated here before the coronal to the curvature, it is favorable. And if it is a lentulospiral or a reamer that is separated, it is favorable. But whereas if it is a short fragment, if it is a curved root canal, and if it is apical to the curvature, night file or H file is difficult to retrieve. Then irregular canal diameter like canines, distal root canals of mandibula, molars, lower incisors, etc. It is favorable to remove. But if it is a round diameter, it is difficult to retrieve. Bypassing is possible. Bypassing is impossible in apical part of the root canal. Then apicoectomy is possible, and this is here in this when it is fractured in this apical part. This is often difficult, but this is not a possible option in all the cases. So basically we have to know the factors that is affecting the favorable retrieval and also difficult retrieval, and also the measures that is used to retrieve the separated instruments. Now we have obturation related mishap, that is mainly the over obturation or under obturated root canals, nerve paresthesia and vertical root fractures. So over or under obturated. If it is an over obturated canal, we have two scenarios for obturation. Either it is overextended or underextended. So if it is overextended, it can cause periapical like if there is an already there is a lesion below the root apex, and if already the material has extruded below, there are different types of sealers that we can use. So it depends on the sealers also. If it is a resin based sealer, it can cause more inflammation compared to a medicated sealer. So if this it is based on the material, the sealer material, and also the filling material, that we can assess the treatment outcome. So if it is, as mentioned, if it is a resin-based sealer like AH plus or AH26 and all, this can cause periapical inflammation, and it can cause inflammatory changes within the periapical region. And the patient can present with pain, etc. But if it is a zinc oxide eugenol based sealer or a steroid containing sealer, if it slightly extrudes below, the patient will not complain of pain. So that is one situation. And also, if the GP is extruded beyond, it can cause a periapical irritation. In some cases, a macrophage activity can take place, inflammation can be caused, patient can present with pain. But in certain cases, the patient may be completely asymptomatic. Then, if it is a case of under obturation, the proper seal is lost. Even for over obturation, the proper tuck back or the proper seal is not created. So, there can be an ingress of bacteria through the apical foramen in both the cases, in both over and under obturation. So see that the working length is correct, and the working length, there is no loss of working length anywhere. Proper use of irrigants and sequential use of instrumentation can lead to proper obturation. So that is the main obturation related problem is mainly the over or under obturated root canals. Next is the nerve paresthesia. Again, this nerve paresthesia can occur because of the filling material, because of the component release that is occurring because in the filling material. That means any of the sealers or the filling the core material, that means the GP, the components that is released from this sealer can cause a nerve paresthesia. Next is a vertical root fracture. This vertical root fracture is the most frustrating complications of this root canal treatment. And here the prognosis if of any vertical root fracture case is poor because this tooth cannot be saved in most of the reasons. And tooth extraction or root amputation is the only way of treatment for vertical root fractures. So, in vertical root fracture, if we are trying to save the tooth, our main aim should be to avoid leakage through the fracture line. That means to eliminate the fracture or the leakage of bacteria along the fracture plane. So, our aim of vertical root fracture management is this. If we are not able to accomplish this, that means if we are not able to get a proper seal to avoid this ingress of bacteria or to prevent leakage of the oral fluids, it is better we extract the tooth. Okay. And if suppose a proper seal can be obtained, the materials like GIC, 4-meta, dual cure resin cements, fiber post with composite resins can be used as a material of choice for this proper coronal seal. Now, multi-rooted teeth can be successfully treated by resecting the fractured root either by root amputation or hemisection. All this root amputation, hemisection, bicuspidization will be telling in this endodontic surgery part. Okay, so just remember that if it is a multi-rooted tooth, okay, if it is a multi-rooted tooth, and if there is a fracture line in this tooth, if there is a vertical fracture in this tooth, in this root, either we can do a procedures like root amputation or hemisection or bicuspidization. We'll be dealing with that in the endodontic surgery part. For single rooted tooth, there is no options like hemisection, bicuspidization, root amputation, etc. So, root amputation can be done. That means the apical part of the root can be cut wherever the fracture extends to. If it is in the apical or the middle or the coronal. So, in that case, we can go for a root amputation. But other than that, for single rooted teeth, the prognosis of a vertical root fracture is very poor. So, extraction is the only line of treatment. For prognosis for posterior is comparatively better when compared to that of a single rooted tooth. Now there are other mishaps that is occurring, that is the post space perforation. When it is a grossly decayed tooth, we have to restore the tooth using a root canal, doing a root canal treatment and doing a prosthetic rehabilitation of the tooth. So for prosthetic crown placement, if it is a grossly decayed tooth, we have to place a post. So to prepare the post space, we use piezo reamers. So we have to remove the GP, retaining apical 3 to 4 mm of the GP, and rest of the GP has to be removed using a piezo reamer. Ideally, remove the GP using Gates Glidden and prepare the post space using piezo reamer. So just this is also just for information. Piezo is used for post space preparation. So just remember piezo P and post P. So it is used simultaneously. Then we have other mishaps related to irrigation. That means when the irrigant extrudes beyond, the patient can present with hematoma or various other like ecchymosis, etc. Then the tissue emphysema, that means air drying during the procedure. Then instrument aspiration and ingestion. So rubber dam application is must in such cases. So because the if we are working especially with upper molars like 27, 17, 1626 and all, there is a chance for the instrument aspiration. So to prevent that, always isolate the tooth with rubber dam and then perform the root canal procedure. So to conclude this topic of endodontic mishap, we basically need to know the definition for endodontic mishap, then the classification according to Ingle, and so that is very easy to remember, that is access related, cleaning and shaping related, obturation and miscellaneous. So in that we have to know in detail about the access perforations, ledge formation and ledge prevention, and also the root perforation. And in obturation, we need to know about vertical root fractures, miscellaneous post-paste preparation. So thereby knowing this management, we can try to increase the prognosis of the mishap tooth. Thank you.